Senator Murkowski.
Thank you, Mr. Chairman. Dr. Bhattacharya, welcome back to the committee. I appreciate the responses that you had to Senator Collins, particularly as it related to challenges for early career scientists and what we do to inspire, to encourage them, to keep them here in this country, to view the opportunities here. So I am hopeful that the modernization plans that you are prioritizing really do focus in on some of these retention matters. I think it's so important in so many different spaces. I also want to acknowledge her question and your response as it related to women's health and the need to ensure that when we're talking about health disparities, when we are talking about those matters where we are looking at specific populations, we don't just say, well, we have to put everybody in the same bucket. Everybody, the rising tide lifts all ships, and so we're just going to focus on everybody, when in fact there are certain populations that do have health disparities that are so remarkable, and remarkable usually in a negative way. And that's certainly the case for Alaska Natives, Native Hawaiians. You and I have had a conversation about this. These communities continue to experience some of the highest health disparities, the lower life expectancy, higher rates of chronic disease, behavioral health challenges, suicide, particularly in the remote and rural areas. And so making sure that when it comes to health research and access to care, we are evening these areas so that we can really focus in on why we have these significant health disparities. So you've mentioned in response to Senator Collins your effort when it comes to women's health. You mentioned minorities in general, but can you speak to your understanding again to the disparities as they affect Alaska Native American communities, and NIH's responsibility, because it's a different responsibility here. You've got a federal trust responsibility to our tribal nations.
Senator,
Can you put that in context for me?
Absolutely, Senator. Thank you for that question. I've had the privilege of multi-day meetings with tribal councils to understand the challenges of doing research on those populations, or with those populations, I should say. You're absolutely right. The health needs of those populations are severe. Higher rates of diabetes, higher rates of alcoholism, drug abuse, much lower life expectancy. And I entirely agree with you. We have a special obligation, special treaty obligation to help. At the same time, there's deep distrust in those communities for researchers. They don't want a pinheaded scientist like me descending on them and doing research. What they want is community participation in research. And I've been working with folks at the NIH to make that happen, make that a reality, where the Native communities have an input into the research questions that get asked, have control over the biosamples that they contribute to these research projects. I want to build that trust relationship so that we can help answer the questions that can make those communities healthier.
Well, and I would offer some of the expertise that we have in Alaska and would welcome a visit for you to sit with some of these experts just about this. Let me ask about some of the vacancies that we are currently seeing within the NIH. I'm concerned that 15 of NIH's 27 institutes and centers are under some form of interim leadership. In other words, they don't have any permanent directors. It's my understanding that you haven't replaced these directors yet. Efforts are ongoing. At least one institute, the National Human Genome Research Institute, has been operating without a director for 10 months now. We get you've got to have good folks in place, and I respect that you're seeking that, but can you give the committee any quick update on the process and timeline for filling some of these really important leadership roles?
Sure, Senator. So I've established a process to make sure that there's excellent scientific input as the primary driver for who I suggest take control of those agencies. We're moving as fast as we possibly can. Just this week, I made recommendations for 2 of those institutes. The secretary, of course, has the final say, but he's listening to my scientific judgment. So we're working as fast as we can, but I don't want to shortcut the process of identifying, and dozens and dozens and dozens of candidates have applied for every single one of those positions. We're interviewing them. We're having scientific staff interview them. The focus is on getting professional judgment of the NIH folks to help make good advice about who should be next director of those institutes. I agree with you. Those institutes and leadership are tremendously important.
Appreciate that. Thank you, Mr. Chair.